Why is COMLEX Level 3 OMM scoring so often misunderstood? Imagine studying for a big exam and feeling confident about your knowledge of osteopathic manipulative medicine. Then you see your score and wonder what it really means. That confusion is common among students preparing for the comprehensive licensing exam. The reason is that the scoring system for the COMLEX Level 3 Osteopathic Manipulative Medicine section is different from what many expect. It uses a converted 3-digit score that ranges from 9 to 999, with an average score around 520. But this number isn't meant to show how well you did in detail. Instead, it mainly indicates whether you passed or failed, with the passing mark set at 350. So, students often get caught up trying to interpret this score as a precise measure of their OMM skills, which it isn't. Another reason for the misunderstanding is that OMM makes up only about 10% of the entire exam. This small part is woven into complex clinical scenarios that include internal medicine, surgery, obstetrics and gynecology, and other areas. The questions are not just about knowing OMM techniques but about applying osteopathic principles in real patient cases. This integrated approach can make it tricky to see how your OMM knowledge impacts your score. Students might think that doing well on OMM questions alone guarantees a high score, but the exam assesses your ability to use osteopathic concepts within broader clinical reasoning. Plus, the exam emphasizes managing patients holistically. You might be asked about long-term care plans or multiple comorbidities, where OMM is just one piece of the puzzle. The scoring reflects your competency in this overall approach, not just your ability to perform isolated OMM techniques. This can be confusing because students often expect a straightforward score for each section, but the exam is designed to evaluate your clinical judgment and osteopathic reasoning in context. Adding to the confusion is the fact that earlier levels of the COMLEX provided detailed numeric scores for each section, including OMM. Now, Level 3 is pass or fail, which can make students feel uncertain about how their OMM performance is evaluated. They might wonder if they need to master every detail or if passing the exam is enough. The truth is, passing is the main goal, and the numeric score beyond that isn't used by residency programs to compare applicants. The exam blueprint also plays a role. It covers many domains and clinical scenarios, making it hard to predict exactly how your OMM knowledge will influence your overall score. The broad and sometimes vague outline can lead students to overestimate the importance of isolated OMM facts. Instead, focusing on understanding how to apply osteopathic principles in patient care and developing strong clinical reasoning skills will serve you better. In the end, understanding these points helps clarify why students often misinterpret the COMLEX Level 3 OMM scoring. It's less about a perfect number and more about demonstrating your ability to think holistically and apply osteopathic concepts in real-world situations. Preparing with this mindset means focusing on clinical reasoning, practicing integrated case scenarios, and not stressing over the exact numeric score. Remember, passing the exam is the main goal, and mastering how OMM fits into patient management is what truly counts.